When taking blood pressure, there are two pieces of equipment needed: the stethoscope and the sphygmomanometer. The sphygmomanometer consists of 6 different parts: the gauge, the bulb, the cuff, the valve, the bladder, which is inside of the cuff, and the tubes. We pump this up to about 20 or 30 millimeters of mercury above the patient's expected systolic blood pressure to completely block off blood flow through the brachial artery.
Before beginning, make sure the patient has sat comfortably with their left arm being fully supported on a flat surface at heart level for at least 5 minutes. When sitting, the patient should have their back and arms supported and their legs should not be crossed. Index and range markings ensure use of the correct cuff size. The artery mark indicates proper cuff positioning. To begin, place the cuff over the bare upper arm with the artery mark positioned directly over the brachial artery. The bottom edge of the cuff should be placed approximately 1 inch above the elbow. After wrapping the cuff securely around the upper arm, close the valve by turning it clockwise. Hold the gauge and begin to inflate the cuff by squeezing the pump to reach approximately 160 to 180 millimeters of mercury, or 20 to 30 millimeters of mercury above the patient's normal systolic blood pressure. When using the stethoscope, ensure that your pieces are pointing forward. Place the chest piece of the stethoscope within that 1 inch space left between the elbow and the cuff. Gradually begin to open the valve to deflate the cuff at a rate of 2 to 3 millimeters of mercury per second while listening for the cough sounds. The first sound heard is known as systolic blood pressure. It is the measurement on the gauge at the precise moment you hear the heartbeat. This is due to the sounds changing each time turbulent blood flows through the brachial artery. Once these sounds disappear, it is known as laminar and is where diastolic blood pressure is recorded. We can't hear diastolic blood pressure because it is the pressure between heartbeats.
The patient's blood pressure was 118/60. We know this is normal because the normal systolic blood pressure is below 120 and the normal diastolic blood pressure is below 80. The units that we use for blood pressure is millimeters of mercury.
When interpreting blood pressure, this is the chart that you can base your numbers off of. For normal, it's below 120 for systolic and below 80 for diastolic. For prehypertensive, your numbers are going to be from 120 to 139 for systolic and between 80 and 89 for diastolic. For stage 1 hypertensive, between 140 and 159 for systolic and between 90 and 99 for diastolic. Stage 2, 160 and up for systolic and 100 and up for diastolic.